So now we look at how this system can be reformed. So there are, as we have looked in previous modules, there are enormous challenges. They are fiscal, cultural, social, and administrative constraints. Demand side constraints are also there. Supply side constraints are also there. So people live in hope and despair at this moment. So what should be done? 18th Amendment is there. It provides some opportunities, but will also need a lot of work to work in properly. Recently, the local government system was dismissed. So that is a problem, because health is basically an area which needs local government help. Currently, the fiscal constraints are increasing at the federal and provincial level, and if we look at this economic survey data, we see that both federal and Punjab have reduced their health budgets or health expenditures in the last year, and various free facilities which were available earlier were abolished. A new health insurance model was introduced, which aims to reach the poor through universal access, but it's still new and we don't know whether it will work or not. What is required is stakeholders consensus. So one party comes with one agenda and then the other party comes with another agenda. So we need all the political parties to sit together and decide what they want to do in the health sector. There's also need to be more money in the health system. So we need a new NFC award or some changes in the NFC award so that more money can be given to provinces for healthcare. Autonomy of health institutions. So hospitals, especially tertiary care hospitals, can be made more autonomous to deal with their own problems rather than looking at the provincial health departments. The duty on cigarettes should be increased because it leads to health costs in terms of lung cancer and many other types of cancer. There is an suggestion of providing more cash to women. So women under the Benazir Income Support Program were given money for expenditure, and then if their children are going to schools, they are given extra money. So maybe they are given extra money for health related expenditures too. A federal health information hub is needed, and transparent governance is needed if we want to improve the health system in Pakistan. Maybe there is the need of a health service, so a separate service in which there are not many journalists, but people who are professionals like doctors or health management specialists who can deal with the health issues rather than with bureaucrats who have general education and know nothing of the health sector before being appointed in the health department or the Ministry of Health. Accountability is, of course, required. A compulsory health insurance for all, that can be a suggestion to improve. We should have more talk of prevention rather than curative medicine. So prevention is more important, it's cheaper. So we should have more talk of health and hygiene in our school education and school curriculum. Everything can be done, but if the increase in population or the pace of increase in population is not decreased, things will not improve, because whatever we do, we spend more money, we build more hospitals, BHUs, RHCs, all. But then if the population is increasing at such a rate, the facilities, the doctors, the nurses, the dentists will always be less than what is required. So we need to have a population planning program, and we can learn from Iran, Bangladesh, Malaysia, other Muslim countries who have reduced their population increase. Thank you.